PPO is one of the most important plan types for an AR caller because the word PPO creates a dangerous misconception. If you think PPO means the patient can go anywhere and the claim should pay, that is not correct. A PPO usually gives you access to out of network care, but the benefit level, authorization rules, network status, allowed amount, deductible, co insurance, plan specific exclusions, and payer specific rules still determine whether the claim pays or not. Healthcare.gov defines a PPO as a plan where members generally pay less for in network providers, but if they use out of network providers, they pay an additional cost. Imagine you receive a denial that says provider out of network. You look at the patient's insurance card and see one word PPO. You might immediately think, wait, PPO allows out of network services. Why did the payer deny it? If you think like that, you may lose provider money because PPO does not mean automatic payment. A PPO is a network based health plan that generally gives you more flexibility to receive covered services outside the preferred network, usually at a higher member cost. So, when a PPO claim is denied, our job is not simply to ask, what did this specific PPO plan allow on this specific date of service for this specific provider for this specific service? That is where professional AR follow up begins. Today, I'm going to show you how to think about a PPO like an AR expert, not like someone simply reading an EOB. Let's start with a question. What is a PPO plan? Let's make the PPO plan simple because as an AR caller, you don't just need to know what PPO means. You need to understand how the plan actually behaves when you are working on a claim. PPO stands for Preferred Provider Organization. A PPO is a type of health insurance plan that has a network of doctors, hospitals, and other healthcare providers. Now, here's the part an AR caller should remember. PPO gives the member more freedom to choose providers. If the patient receives care from a participating or in network provider, the insurance plan generally provides a better level of coverage, which means the patient's out of pocket cost is usually lower. But here's where PPO becomes interesting. Think of a PPO like having a VIP pass to the healthcare network. With many HMO plans, the patient typically has a PCP who coordinates care and may need a referral to see a specialist. But with a PPO plan, the member generally has more flexibility. If you need to see a specialist in many PPO plans, you can go directly to that specialist without a PCP referral. That sounds great, right? But there's a trade off. More freedom usually means more cost. PPO plans commonly have higher premiums than many HMO plans, and going out of network can mean significantly higher patient responsibility. And depending on the plan, some services may have limited or no out of network coverage. So, as an AR caller, never stop at it's a PPO plan. That information alone does not tell you whether the claim should be paid. You still need to investigate. Was the member active on the date of service? Was the provider in network for that specific PPO plan? Was the service covered? Was prior authorization required? Was a referral required under this specific plan? Was the claim processed according to the member's benefits? And most importantly, what exactly does the EOB or ERA say? Because PPO does not automatically mean everything is covered. It means the member generally has greater provider choice flexibility, while the plan still applies its own network rules, benefits, deductibles, co-pays, co-insurance, authorization requirements, and out of network provisions. Now comes the question everyone asks. How many types of PPO plans are there? You may come across four common PPO variations. It may be a standard PPO where in-network care usually costs less, while out-of-network care may still be covered at a higher cost. Another may be a high deductible PPO, which generally means lower premium, higher deductible. The patient usually pays more out of pocket before the plan starts paying for many covered services. A third is a tiered network PPO. Here, in-network providers are placed into different tiers and the patient's cost depends on the tier. Tier 1 equals lower cost, Tier 2 equals higher cost, out of network equals highest cost. And the fourth is a narrow network PPO. This means a smaller network with fewer participating providers, so the patient's choice is more limited. And depending on the payer, you may see other PPO variations, product names, or plan designs. But here's the part I really want you to remember as an AR caller. When you are working an actual AR account, the first question in your mind should not be which PPO variation is this. Your first question should be, is this provider in network or out of network for this patient's specific PPO plan on this exact date of service? Why? Because that one answer can change how the claim is processed and what the patient may owe. If the provider is in network, I look at the provider's contracted or allowed amount and then check the patient's applicable copay, deductible, or co-insurance. If the provider is out of network, I immediately check the patient's out of network benefits, cost sharing, the allowed amount used by the plan, and whether any special circumstances or legal protections apply. And here's something I learned very quickly in AR. Never look at the patient balance and assume it's correct just because insurance didn't pay it. I want to know why insurance left that balance. Was it the deductible, co-insurance, a non-covered service, out-of-network processing, or something else? That's the real AR mindset. Don't just look at what insurance paid. Find out why they paid that amount. And that's why when I see a PPO claim, my brain goes straight to network status first, then benefits, then claim details, then patient responsibility. That's how you investigate a PPO claim instead of simply reading the EOB. If this PPO breakdown helped you think like an AR expert, not just read an EOB, don't stop here. Stay connected for the next session. Follow for more real-world AR, denial, and RCM training. Because in AR, knowledge is good, but knowing what to check next gets claims paid. Happy learning, and I'll see you in the next video.